Hello, my name is Catherine Parati, and I'm a pediatric nurse and a primary care pediatric nurse practitioner student at Rush University. And this is a presentation on asthma education and management in the school setting, specifically for Moving Everest staff. Here is a list of objectives of topics I will be discussing in this presentation. Asthma is a chronic illness that affects nearly 6.2 million children in America, meaning 1 in 11 children have asthma in this country. It is not only a healthcare burden, but also a financial and academic burden in this country. And on top of that, low socioeconomic African American inner city youth are disproportionately at higher risk for asthma prevalence and morbidity, more than the general population. This is key for Moving Everest, which has a high proportion of low-income minority elementary age students as their student population, as well as there's a higher than national average prevalence of asthma within their population. The good thing is there are many researched school-based asthma management programs that have been shown to reduce asthma symptoms, hospital visits, as well as improve school attendance and academic performance when they're implemented in the school setting. So a quick review of asthma. I know many of you are familiar with the disease, but just a little bit on what's actually going on inside the child's lungs. On the right, you'll see a healthy, normal airway where the tissue, the pink tissue, looks healthy, and the airway lumen, so the hole in which the air kind of moves through, is nice and large and easy to breathe. On the left shows bronchial asthma, so your bronchioles or lung airways when an asthma attack is occurring. And three things are really going on here. First, you'll see that there's tissue inflammation. So the pink tissue inside the airway is more inflamed, making the airway lumen actually smaller and more difficult for the air, which you can see is the blue arrows, are more difficult to pass through. The second thing going on is there's bronchial constriction. So the red bands around the airways up top you can see are contracting, getting smaller and tighter, making the airway tighter and the lumen smaller for the air to pass through as well. And last, there's mucus production in the lungs. So the yellow, goopy, sticky stuff in this picture is kind of tacked onto the airway lumen inside of that, trapping particles and making that lumen smaller and obstructing the lungs, making it more difficult to breathe. All three of these components contribute to an asthma attack. And although there's no cure for asthma, by managing asthma well, we can better control and prevent these symptoms from happening. So asthma triggers are the elements in the environment that kind of precede an asthma attack or make an asthma attack occur. And they can be different for each individual child. So common triggers are tobacco smoke and secondhand smoke, so the smoke that stays on our clothes or couches, dust mites, air pollution, cockroaches, pets, mold, viruses, reflux, physical exercise, foods, and fragrances. So as Moving Everest staff, recognizing our students' individual triggers can help them to avoid those specific ones. So that might mean not having a class pet if we have a student that pets is a major asthma trigger. By recognizing the early asthma warning signs of an asthma attack can also help a child to get their treatment earlier and prevent a more emergent asthma attack later. So early warning signs of an asthma attack could be repetitive coughing, chest and throat tightening, shortness of breath, or mild wheeze, which is that kind of higher pitched noise that they may have when they breathe in or out. And if they have these early warning signs, you want to walk the student down to the nurse's office so they can receive their albuterol from the nurse or the administrator down in the main office. And then one of them will wait 5 to 10 minutes with the student before they reassess for those same early warning signs or worsening warning signs. Now, hopefully, after they receive their medication, they are feeling much better and can return to the classroom. More emergent asthma signs would be rapid breathing, seeing their nostrils flare as they breathe, or their ribs showing when they breathe, if their ribs are retracting, or if they're having trouble speaking. If they can't get a full sentence out, then that is more of an emergency. So again, you want to walk them down to the nurse's office, have them take their albuterol, but then you want to call their healthcare provider or 911 if it's an emergency and they cannot breathe. Asthma action plans are kept in the nurse's office, and they are updated each year by the healthcare provider, and they are individualized plans for each child's asthma and what to do when they're feeling healthy, as well as when they're having the early warning signs and emergent signs. This is not the role of the Moving Everest staff to read these on the regular, but it's important to know where they're kept and what they say on them in case of an emergency when an administrator or nurse is not available. There are two main asthma medications. One are the long-term controllers, which are the medications taken at home, usually morning and nighttime, that help to reduce inflammation and prevent asthma attacks. It's key to know that these medications will not help in an asthma emergency, and they are not kept at school. The medications kept at school that help with asthma attacks and reversing all of those components of an asthma attack, the inflammation, the bronchial constriction, and the mucus, those are the short-acting beta agonists, which is a long fancy word that I've shortened to SABA. And the main medication that I'm sure you all have heard of is albuterol. And this is kept in the nurse's office or the main office. The two ways this medication is delivered is through a metered dose inhaler, an MDI, which you can see in the top right-hand corner of this slide. Many people call it a puffer or an inhaler. And the other way it's delivered is through a nebulizer, which is more often used in a healthcare office, facility, or at home, not at school. In the bottom right-hand corner of this slide is a blue spacer, which helps to deliver the medication in younger children. So the inhaler goes into one part of the spacer, and then as the child is showing, the other side goes directly into the mouth. And to deliver it, you would press down on the inhaler. The medication is released into the spacer. The child would breathe 6 times. You can count out loud. And then you can kind of take the spacer out of the child's mouth, and the child will hold their breath for 10 seconds before repeating this process one more time to deliver 2 puffs, or whatever the designated amount is on their asthma action plan. If the plan is not available, 2 puffs is usually the general dose. Now you'll see in this picture, there is a yellow spacer with a face mask, and this is used for younger children that can't keep the mouthpiece in their mouth. So this might be used more for a kindergartner or first grader. But no, if you're in an emergency or on a field trip and the spacer is not available, you can always just put the medication device, the inhaler, inside the child's mouth and deliver the medication that way. It's also good to know that most children with asthma will probably develop asthma symptoms when they're running around or exercising for a good while. This does not mean that they should not exercise. Physical activity is a very important aspect for everyone's health. And so instead, some children may just need to take their albuterol prior to gym class or recess. So here, this picture shows many different components of a strong asthma-friendly school, which is recommended. These programs are recommended by the National Asthma Education and Prevention Program. And Moving Everest is already doing a phenomenal job at incorporating many of these asthma-friendly components. 2 parts were included this fall of 2018. One was a school-wide plan for asthma emergencies, as well as education for students, staff, and parents about asthma management. So for student education, the American Lung Association's Open Areas for School program was taught to the 3rd grade students with asthma as a pilot project this fall. It is shown to increase students' self-management skills, self-efficacy, as well as decrease the number and severity of asthma exacerbations at many other schools with similar demographics to Moving Everest. This fall at Moving Everest, if evaluations show that it was successfully able to increase students' management skills, it could be implemented annually at Moving Everest as long as staff are willing to become certified facilitators of this program. Any adult in the community may become an Open Areas for School certified facilitator, whether it's a staff school member, a healthcare provider, a parent, or a community member. They just must not have used tobacco in the past 12 months, and they have to complete the free 1-hour online training course. This information can be found online at the American Lung Association's webpage for Open Areas for School certified facilitators, or by calling the number on this slide. So the school-wide asthma emergency protocol was given to every teacher, as well as posted in the nurse's office, gymnasium, and teacher's lounge this fall. This is just a good reference on what to do in case of early asthma warning signs or an emergency while in the school setting. Thank you so much for listening, and I hope you learned something more about asthma management in the school setting. If you have any questions at all, please feel free to reach out to me through my email address on this slide. And thank you so much.